you for that. So let's move on to health in general. So what have you got for us?
Right. Well, yeah, let's look at the NHS because we're in a bit of a mess, aren't we? So, NHS Networks have brought out this article, Internationally Educated Nursing Staff. So, they're saying that many migrant nursing staff, two-thirds actually, a huge proportion, are thinking of leaving the UK due to cost of living pressures, and they don't have any recourse to public funds. So, they have to rely on temporary visas and pay tax, but they don't get any indefinite leave to remain. And that's what's important here. So when I went to look at the Royal College of Nurses, the RCN also have said to scrap unfair benefit rules because migrant nursing staff, they're saying they're calling it a mass exodus. And then as we go further on into the report, it highlights this indefinite leave to remain because somebody in the health profession, and of course, Professor Diane Rasmussen McCaddy's mentioned this before as well. If you are in this country, you have to apply for leave to stay, and this is costing £2,885. And we've got 40,000 vacancies in the NHS at the moment, but apparently 1 in 5 on the register are educated outside of the UK. But if anybody wants to read the report, there was a little thumbnail of the report on that slide without a safety net. But let's look at some risks coming forward because we've got more risks, Mpox, you name it. But who's heard of sloth fever? So sloth fever, apparently, it doesn't involve sloths. Apparently sloths can get it, but it comes from mosquitoes and originates from Cuba. But apparently it's heading for Europe and the USA. If you go to the next slide, it tells you quite clearly that this is a mysterious threat. The Lancet call it a mysterious threat. But what's a little bit more concerning is they're saying it's an emerging disease which particularly affects pregnant women. And the symptoms, you might actually find these quite familiar: fever, headache, muscle aches, stiff joints, nausea, vomiting, chills, sensitivity to light, and also just note meningitis and encephalitis. You'll see why in a minute. But the fears are that it could be potentially very dangerous to babies, birth defects, stillbirths, etc. So that's another one to be looking out for. And then, of course, the government are urging students to protect themselves from meningitis. They want them all to go and get jabbed for meningitis, measles, and HPV. So that's for students. And then we can go to antibiotic resistance. I'm just going to go through a few little stories that I think you should be keeping an eye on. So antibiotic resistance in gonorrhoea cases are on the rise. In 2023, there were 85,000 gonorrhea diagnosis. That's the highest since records began in 1918. I wonder why that could be happening. But let's go back to school because, of course, we're off back to school today. Many kids going back, including my grandson, first day at school. And the UKHSA are warning of back to school measles surge, where you get a first dose offered at 1 year and a second dose at 3 years, 4 months. Please, it says, urgent call to parents. And in the next slide, you'll see that again, they're going for parents. Please, parents, go and get your children vaccinated. Not only the UKHSA, but also the NHS. The NHS are putting out an ad promo, which has got kids on it, actually. And I think we have shown this promo video before. But here's a slide shot just to show you if we're not vaccinated, we're not protected. So that's the messaging for children. And of course, we're coming up to, it's a whole vaccination scheme now, isn't it? Coming up to autumn. And now we've got the new RSV vaccine. And it says here, RSV usually gets better by itself, which it does. But they are still promoting and pushing a vaccine. So who gets it? Pregnant mums, of course, 28 weeks onwards. But if you're over 80, you don't get it. So you're not deemed vulnerable enough at 80 to get it. But the vaccine drive is on full pelt now. And what concerned me was this put out by the UKHSA, which are calling it a marketing campaign. Now, doesn't that just say it all? A marketing campaign launches to drive up childhood vaccinations. They're really going for the kids. So let's have a look at the NHS vaccinations, especially for children. And by my reckoning, babies under a year are due to have 8 jabs from 8 weeks to 16 weeks. That's 8 jabs in 8 weeks. And some of those are the 6-in-1, which is called a hexavalent. Let's not forget hex means a curse, but they're called 6-in-1 hexavalent with diphtheria, Hep B, Hib, polio, tetanus, and whooping cough combo. So they get all of those. And at 1 year, they get a further 4 jabs. So by the time they're 1 year old, they've had 12. So please keep an eye on your child's immunisation programme and what you're being expected to give to your child. Staying on vaccines, many of you might remember this interview that we did with Peter Todd, consultant solicitor, and Alex Kelly. They were both talking about vaccine injuries and the vaccine damage payments. And Alex set up a COVID vaccine injured and bereaved legal fund, which you'll see on the next slide. And please do go and have a look at that. And if you are able to donate, they would be incredibly grateful. And that's Peter Todd, the solicitor. Now, he's just put out an announcement. And thank you to Alex for sending me this. And I'll leave it for you to freeze the screen and read. But basically, there have been 14,000 claims, 6,134. The initial decision have had an initial decision, but there's been less than 50% success rate. 97% have been initially declined. 358 claims had the causation accepted. However, no award was made due to the disablement being considered insufficiently severe. 65 awards where the applicant had died. At 1,012 requests on reversal of consideration have been filed. And in summary, really, Peter Todd says this scheme is completely unfair, huge unfairness, and a total lack of justice. So that's where we are. With regards to vaccine injuries. But let's stay on vaccines because Pfizer are still very much in the news and they are pushing stuff down the pipeline. But they're in trouble. Well, they've been in trouble many times before, but here we've got, they're being sued by Texas over misleading marketing. So they're calling for deceptive marketing, saying that there was no 95% efficacy based on the 2 months clinical trial data. And it's not just Texas, it's Kansas as well. Only Kansas are suing Pfizer with regards to their vaccine and myocarditis. So this is really important, a really, really interesting case, and please one to keep an eye out. But despite that, despite all of that and the damage that we know that these injections have done, and the book of risks that I have, the Pfizer analysis documents, which many of you have as well, we still have got approval. So the FDA have just approved Moderna and Pfizer's BioNTech's, their updated COVID-19 vaccine. So they're still rolling it out. And they're also rolling out the propaganda. So Pfizer is actually coming to school. You don't have to go to Pfizer anymore. Pfizer's coming to school. And this is the video that they've just released on school.
The future of science requires us to be more creative.
Pfizer School of Science mobile experience is a fantastic, interactive, escape room-like experience for school students to come through and get excited about science, technology, engineering, mathematics. And this experience really brings out their inner scientists and helps solve a mystery along with our Pfizer colleagues.
Go ahead and get your lab coat. This right here, and basically play. They're having fun with it. What is our breaking news right now?
People are showing up at doctor's offices with green
lizard skin.
They can leave their classrooms with their teachers, they come to this great environment, and they get to actually experience the science through the work they do, the problem solving, the team building, versus through a lecture.
The tasks that they have to complete for each room, they're actually learning different skills.
Critical.
So Pfizer's coming to school, and if you stay tuned for Extra, I'm going to be showing you some magic moments from Pfizer as well, and also their One for All app. So come back to us for Extra and you'll see why I'm so concerned about apps in general. Over to you, Mike.
Thanks, Debbie. Thanks.